In our communities, thank you very much. All right, so the reason lead was taken out of our communities, it was taken out of gasoline, it was taken out of paint, it was taken out of consumer products. That was because we found out that exposures to lead in childhood could result in up to a 7-point drop in IQ, along with other cognitive deficits. What have we found about THC exposures that start early and often, and Dr. Turnsley touched on that? It can result in an 8-point loss of IQ over time, by the time you reach young adulthood. And 8 points, let me remind you, if you got 120, 130, 140 IQ, like some of us here, 8 points doesn't make much of a difference. You're going to do really well. The average American has an IQ of 100 points. And you subtract 8 points, that brings you down to 92, and you're moving right into the category of functional disability. So 8 points of IQ is a high price to pay for the average American. So again, I just didn't understand why we're taking lead out of the communities at the same time that we're putting THC into those same vulnerable communities. So I'm going to go back to the farmer's daughter perspective too. I grew up on a farm with truckloads of seeds. I grew up in a family that watched the commodities market every single day as a matter of survival, because they had to decide what to grow a year in advance to try and make a living and stay on the land in the following year. Amy showed us in the right hand we have now the number of Americans that use legal drugs. At about 167 million using alcohol, about 167 million still using tobacco. And while it was still illegal, we had 20 million or few using cannabis and THC. Now we've introduced the profit motive. We've introduced the profit motive in the open markets. And look at the cover of Fortune magazine. We have a hopeful young venture capitalist hoping to make a killing in the marijuana market. And what happens? This is a market stampede, and I have a thundering herd here of bison, which we also see well out on the plains. There is a market rush to produce more of that commodity to try and make some money in the markets. So I kind of come out of the protest movement, and right around the turn of the century, the last 5 to 10 years of the 1900s, about 25% of American farmers left the land because they could no longer make a living. And so I was at a farm rally during Farm Aid back in 1999 with Senator Paul Wellstone, and there was a young farmer from the southeast, I think he was from Georgia, who just shouted, cried out, just tell us what to farm. We will farm anything. Because when you get connected to the land, you do not want to leave it. It's a way of life that is really wonderful, and it's hard to leave it. Now, there's a looming crisis in American farms right now, and this lower picture I have here is from 2017. So you put these kind of numbers out in front of folks who are trying to stay on the land, and you tell them for your wheat you're going to get $232 an acre, but for your pot you can make $1.1 million growing marijuana. What happens? This is the market stampede. And that leads to production surpluses. What happens when you grow too much of a commodity? You end up with production surpluses. And you can see here we've got sugar, we've got soy and corn, and we've got wheat, and we've got sugar beets that farmers are told to leave them in the ground, let them rot, we'll pay you. We can't afford any more sugar on the market. There's a 1963 farm co-op in Canada. This isn't something new. That's piles of excess wheat that cannot be sold on the markets because it has no value because of overproduction. So let's take a look at what's happening already in this infantile cannabis and THC market. You can take a look at prices. This was last year. This was news from Bloomberg, where it said that marijuana in Boston was selling for about $11 a gram. But prices were already collapsing out west because there was oversupply. So you can find lots of information on marijuana price collapses, how legalization has caused the price of marijuana to collapse. But I put this slide together in February. The news in Oregon is that there's so much excess pot that farmers can't sell it for $100 a pound. Now at these prices on the right, People are banking on $4,900 a pound. $4,900 a pound at that $11 a gram price. But we got the farmers out in Oregon telling us I can't get $100 a pound. So any of these financial models any communities are looking at right now are not worth the breath that it takes to express them, because the prices of the commodity and the prices of the drug are changing constantly. So why does price change matter? And here is some information from the National Institutes of Health. This is some research that is done on why changes in price matter when you're thinking about marijuana policy. It's because the study they did, and all these links are out, by the way, you can go read the studies yourselves. A 10% reduction in the price of marijuana would lead to a 50% increase in the number of high school seniors reporting past year and past month use. Now, this was just marijuana. Now we have this whole new class of new drugs, which is not a soft drug, like it was referred to in the Netherlands. It's now hard drugs that are going to be cheap and plentiful. That's why we've moved into new territory under the program, under the policies we're looking at now. So what happens? This is really basic market economics. It's really basic commodity economics. You've got oversupply, you have price collapses, you have increased use. And when it's marijuana and THC, what happens with increased use? We have increased substance use disorders. We're in the middle of an American addiction epidemic, and adding more of an addictive substance into the population is going to drive indicators in the wrong direction. And this is not new. If you understand some of this basic market economics and commodity market economics, they are really, really good reasons for keeping narcotics and hallucinogens off the open and free markets. So we kept talking about a public health lens. Look at this policy through a public health lens, and in the very big picture, here's what I think of as the public health lens. You take a look at the leading causes of premature morbidity and mortality, and these numbers are from just after the turn of the century, in the early 2000s. Tobacco smoking, even though we've cut rates by, gosh, down to about a third since big tobacco was at its peak, 450,000 people a year still die from tobacco-related illness in this country. First leading cause of death. The second is overweight and obesity. Now, metabolic disorders are a second leading cause of disease and death. Alcohol is the third. We lose 50,000 Americans every year from alcohol-related disease. Now, but take a look at what happened in 2016, where we had drug abuse in 2003, 2004 is the 9th leading cause of premature death. That leapfrogged to the 5th leading cause of death, was 64 overdose deaths in 2016. So this, when we're taking a look at the public health lens, we're looking at harm across the population. We care about 325 million Americans, not just our neighbor down the road, not just the kid in our high school, but the entire population. So public health looks at the risks at a population level. So let's take a look at the commodities that are involved in these leading causes of premature death and disease. These are consumption rates for tobacco. And I just learned recently that back in 1900, people didn't really get lung cancer. But the cigarette was introduced in the early 1900s as a healthier alternative to cigar smoking. And big tobacco was born, and nicotine was highly addictive, and the tobacco companies started marketing to our soldiers, well, by the middle of the century, when in 1964, the Surgeon General's report was finally put out there, making the conclusive connection between cigarette smoking and lung cancer. They knew this, doctors knew this by 1917, 1920, the early reports were there, and our U.S. Surgeon General didn't make a conclusive statement until the middle of the century, and then we have been reeling back those tobacco smoking rates through massive litigation and master settlements and public education campaigns. And at the peak, people were smoking over 4,000 cigarettes per person per year. So that would be a half a pack of smokes for every man, woman, and child in the country. And I don't think most of the children were smoking, so there was a couple of pack-a-day habits with a lot of Americans. Let's take a look at sugar. This one hurts. I'm a fourth generation sugar farmer's daughter. My grandfather bought some of the first sugar beet seeds out of Belgium. My uncle and my dad formed a sugar beet growers cooperative in the northern Red River Valley that grew to about a $2 to $3 billion industry. This was an important part of our portfolio. So what happened with U.S. sugar consumption? You can take a look back in 1820. The average person would consume about 5 pounds of sugar a year. What's happened now? The average person consumes 100 pounds of sugar a year. And 100 pounds of sugar, just so you know, is about a half a cup a day. That is 400% of the recommended daily allowance for sugar. So the metabolic, and that's tied to the overweight and obesity, the metabolic disorders, which comes from all refined carbohydrates, and you get into a lot of chatting about refined carbohydrates, and there's, you can get into bug dust on that, but sugar's a piece of it. It's too much of it, and it's tied to the second leading cause of premature death and disease in the country. Now let's take a look at what has happened with opioids, and this is a shorter history because we commercialized heroin and brought it to the market in about right around the turn of the century. So during that time, if you look on the smaller graph there is national overdose deaths for heroin between 2000 and 2015. We've had a 600% increase in overdose deaths from heroin. If you look at the right hand, this is consumption of opioids from 1980 to 2014. And this is when the prescription opioids came onto the market, 1,500% increase in use. And that's why you saw that big leapfrogging in opioid deaths to the point that we lost 62,000 people in 2016. And that's why our governor and governors across the country are trying to intervene and cut back on the amount of this drug that is circulating in our communities. So where are we with cannabis? We're commercializing this drug now. And if you take a look at the use rate since 1990, 12 to 17-year-olds, their use rates are up 47%. 18 to 28-year-olds, their use rates are up 52%. 28 to 34-year-olds, their consumption rates are up 63%. So we are at the very beginning of what could be a very harmful trend if we don't wake up and respond now. So why does this happen to Americans? My husband loves to watch comedians in cars getting coffee with Jerry Seinfeld. So he pulled out this, he said, you've got to see this one, it's so funny. Jerry's sitting there with an Austrian comedian named Christoph, and they're in a fast food restaurant, no, a breakfast restaurant. And he's holding up a breakfast with probably 2,500 calories in it, lots of saturated fat, lots of salt, lots of syrup to be poured over that. And Jerry says to the guy, would you eat that? And Christoph responds, no wonder healthcare is so expensive. And Jerry says, you can have all you want. We'll fix it afterwards. Don't worry about the consequences. You eat what you want and we're going to fix it later. That's the American way of life. Well, you know, prevention can become the American way of life too, and we can think ahead and not have those arcs of harm have to happen before we respond. So, you know, unfortunately, we don't in this country often respond to public health threats until we have a body count. But I'm going to ask the question now, as marijuana use doubles among U.S. adults over the last 15 years. Are we manufacturing addiction? Are we putting drugs out into the marketplace, pushing their use onto American consumers, getting them addicted, investing in treatment? Then I call this, I did industrial pollution prevention in my pollution prevention work at the Toxics Use Reduction Institute. I call this a closed loop recycling system. And when are we going to get off that merry-go-round and figure out how to practice prevention first? It's going to be hard to do right now because there's incredible pressure to legalize and commercialize another drug. I call this industrial regulatory capture. I'm one of the people who read the 8,500 words that were in the law that was put on the ballot before Massachusetts citizens. I understood some of it. I didn't understand most of it. It's written to confuse and it's written to hide, as we can see, what actually was going to be released onto the people. But I call this an industry business plan enshrined in state laws. Industry regulatory capture is where the industrial actors gain so much influence over the regulatory process that they dominate the regulatory process. So you're not driven by public health or public safety factors, you're driven by for-profit industrial actors to put more of the product out into the market for profit. I know it well. My family also included a lot of sugar lobbyists at the state and in Washington, D.C. So industrial regulatory capture, we're already seeing symptoms of it. Weed maps is influence in influence industrial zoning laws, and we see lots of industry influence in what is supposed to be a regulatory program in this state. So how do you counteract industrial-driven addiction? So I look back to the time I spent in industrial pollution prevention. Here's what was happening in 1969. That's a picture of the Cuyahoga River on fire in downtown Cleveland. There was so little industrial control that the runoff and the pollution that was coming out of factories after they made profits on their products was flowing downriver into Cleveland to the point where it would catch fire now and then. This was really at the beginning of the environmental movement in this country. So what we were finding is that companies and industries could internalize private profits, but they would externalize their public costs and their public harms onto society. So the cleanup costs or the intervention costs or the people who got sick all got absorbed by our healthcare system. It's hard to count up that kind of social cost, but basically the private industry was not bearing the social cost, the taxpayers were, or the families and the individuals who were harmed. So groundbreaking case in the pollution prevention. History happened right here in Massachusetts where a childhood leukemia cluster was found in Woburn, Massachusetts. We've had upstream contamination causing downstream damage, meaning upstream was the industry, downstream was the TCE or the trichloroethylene that was illegally disposed of that got into the water system. That Woburn, Massachusetts noticed there were 7 kids with childhood leukemia in one very small neighborhood. And it took a number of years to figure out and trace that disease cluster back to its origin. We're going to be needing to look at disease clusters now with a new chemical in our communities. It's going to have to be a lot of research done on that looking forward. So the pollution prevention movement was pushing public costs back onto the polluters, the source, going back upstream to the source of the contamination, and making the folks at the source of the contamination pay. What happened when it made a difference to the bottom line of the industry? They cleaned up their act. They made their processes safer. They managed their materials more efficiently. They released less pollution into the environment. So when there is payment for the consequences at stake, industry cleans up its act and actually ended up running much more efficient businesses and industries. So the drug use prevention movement really needs to think about pushing the cost for the damage back up to the promoters as well. We're in the middle of an addiction epidemic, and millions and millions of Americans are swimming in social waters, and social norming drives behavior. So here's a look at what our kids are seeing now. They're seeing out of Hollywood, glamorizing of cannabis use, really hot actors saying didn't hurt their life, political campaigns at Ohio State University with a mascot called Buddy, who's a standing marijuana, blunt or joint. St. Patty's Day specials up in Colorado where you get cheap weed and go ski. And then Priceless, a children's book called It's Just a Plant, written in 2005. That's the ultimate in intergenerational norming around cannabis use. But society is porous, just like the soils through which toxic chemicals flow in order to pollute water. Drugs don't stay where they're intended to. They too leach out into the community and create exposures harmful to human health. So how did this happen? It takes a lot of work to make this happen. And let's take a look at how you change people's minds about their perception of risk and their perception of harm. around a psychoactive drug. Campaigns of deceit are helpful. Here back in tobacco, the tobacco companies use nurses to drive consumer behavior around their cigarette choices. Here we have marijuana campaigns sending pictures of nurses to every household in Massachusetts a couple of weeks before a state campaign opening the cannabis markets in Massachusetts. Another example of propaganda from the cigarettes heyday, doctors were used to recommend cigarette brands. And again, campaign propaganda coming from cannabis interests sends a picture of a doctor to every household in Massachusetts. Meanwhile, the information from our medical establishment was coming out in an 8-page detailed, fact-based piece of information that didn't get to every citizen in Massachusetts. It got to some doctors, but it didn't close the gap on marijuana commercialization legislation. So it's tough to look at it. There's a lot of people who say they have the science. You can't have a discussion about marijuana when I present my data and you present your data and our data completely conflicts. Where do you get to what the quality of the data actually is? Well, the tobacco companies were pushing out real science in the 1950s that a grumpy lady could have a smoke and her mood would be elevated and she would feel better. It was a scientific fact that tobacco would elevate your mood. So I talk a lot about who owns the science that you're seeing. In this, in the middle of this slide, you see a very suggestive piece of fancy-looking marketing information saying, "Can cannabis cure cancer?" Take a look at who is pushing out that image and that message, and that's Leafly. And Leafly operates, it's a holding company for commercial cannabis interests operating out of Washington. And there is no scientific evidence that cannabis is curing cancer whatsoever, but it's broadly repeated. And I know folks who have skipped their chemotherapy and stuck to alternative treatments and they're not with us anymore. So that's the damage that can be done by poor medical information, is folks don't get the help they really need from conventional medicine that actually has proven outcomes. They listen to things like that. You can see the U.S. Food and Drug Administration trying to get correct information out to consumers. So what do we do now? It's up to every person and everybody in the midst of the American addiction epidemic to understand the pathways of addiction, and most of them are the same. National Geographic did a good issue on the science of addiction. There's new research coming on about how the disruption of the, Dr. Turncliffe could do a better job on this than I can, but the disruption of the cannabinoid system in the brain, which resides in about the same place as the opioid receptors, also disrupts the opioid receptors, which is why we might be seeing this cross-substance addiction patterns. So how are we, as normal everyday citizens, supposed to react, trying to raise our kids in communities with more marijuana marketing, more THC products, more glamorization of the drug, more misinformation? What are we supposed to do? Well, citizens are organizing, finding a very small loophole in the law, very tiny 2-paragraph loophole that allows cities and towns to opt out of supporting and promoting the commercial marijuana industry. This was the first law that was written among all the ballot questions that captured 351 cities and towns, put them in the marijuana market, and made each community jump through hoops to get out of the marijuana market. So they wouldn't have increased supply through manufacturing and growing and retail pot and testing in the community. To date, the marijuana advocacy groups that have written the state ballot questions had cities and towns opt in, which is why in Washington and Colorado, 2/3 of their states never opted into the cannabis programs. 2/3 of the communities in those states never opted into commercial cannabis. Now, so they rewrote the law when they got this one passed, so that 351 cities and towns are in, and you have to jump through some legal hoops to get out. So we'll talk about that later, and I'm available at lunch if people have specific questions on that provision, because it's pretty tough to do. What we are trying to do is empower citizens and give them the courage to speak, because our permission to talk about marijuana as something that could be harmful to our communities was taken away from us because of the shame we hold for the disproportionate impact that arrest or incarceration had on some of the most vulnerable in our community. But we should not let our shame over one perceived problem silence us in discussing another very real problem, and that is the role of this drug in making the addiction epidemic worse in this country. So people need to learn about the harms of marijuana and THC commercialization. And some of that is happening. There's new educational products coming out, new local programming. This is something, unfortunately, every single family has to know about now. Elections really matter, as we know. Local policymakers, I really encourage them to act out of an abundance of caution or precaution. The environmental movement, there's something called the precautionary principle. This came out of the environmental movement, and that's basically when you're making a local decision about a new measure for which there is at least a preponderance or a possibility that you could be doing harm in your community by changing your policy. Act to do the least harm first. Pass the most restrictive policy available to you in your community. Then if things work out, if things work out later, relax that policy. But right now, the level of confidence in the evidence for adverse effects of marijuana on health and well-being are pretty strong. And prevention science tells us that where the perception of harm is going down and where the supply and availability is going up, and now add commercial marketing pressure and advertising, more exposures are going to happen, and if more people are using and more people are exposed, as Amy pointed out, a percentage of those folks are going to be hit with addiction problems and mental health problems. So I can't emphasize strongly enough that if you are interested in preventing harm in your community, pass the most restrictive policy available to you under current law. And we can talk about how to do that later. Basically, you have to run fact-based, science-based campaigns of information for the voters in your community. People in your community have to understand what you understand when you leave this room. And that's great because you've got a lot of PhDs living in your town, and you've got a lot of folks, professionals living in your town who can teach this to each other. There's a lot of communities in Massachusetts who don't have that luxury. So there's a new narrative about why we opt out, and that's basically, according to the precautionary principle, we want to do the least harm possible. Amy showed us that commercialization is making a harmful substance much more harmful. It's a different drug with escalating levels of THC that have never been seen before in the open market, and the countervailing non-psychoactive ingredient, the CBD, remains level or flat. Lots of different ways to use the harmful substance now that we never saw even a decade ago. And a new narrative is emerging. And a really interesting article on the real dangers of marijuana. It's a very level-headed article by Jonathan Calkins. But he points out that heavy users who overindulge and the young may find it even easier to do so when marijuana is legal and cheaper. So those folks who are most vulnerable are going to have an easier time getting and using a drug at unhealthy levels. We've seen this before. People, there's an old narrative out there that marijuana is not addictive. Well, it is, and it's even more addictive at more potent levels. And here is what happens. Where there's more marijuana, more people are using it, and more kids are using it. If this is a lineup of the states from the bottom to the top, and any of those that have a green bar in them either have medicinalized or commercialized the drug, and these are the use rates in those states that have either legalized or commercialized that drug. And so you can see all of the highest use rates are in those states that have medicinalized or commercialized the drug, and the lowest use rates of this drug are in the states that have not done that. There may be fewer and fewer of those as we move forward. Amy showed us an overlay of the data that we're in Colorado, where there is more marijuana, more kids are using the drug. These are other ways to slice the data. You can take a look at 18 to 25-year-old monthly marijuana usage in the legal versus the non-legal states, and it's nearly 50% higher in the legal states. Back to the environment. This whole notion that this is just a plant and this is something natural, there's absolutely nothing natural. What we're seeing in this drug right now resembles nothing that ever originally occurred in nature. What was defined as marijuana in the 20th century was a plant matter with 3% or below THC levels. And what people were using in the 20th century when they smoked pot was 2 to 4%, unless you got some really good stuff that might have drifted up a little more. They have genetically modified and hybridized the plant so that the plant material now can be up to 35 or 40% THC, and we've seen that the extracted THC now is up to 85, 90%. Also, just growing the plant is an environmental loser. It's energy intensive, it's chemical intensive, it's water intensive, and it has a really lousy environmental footprint. So even Mother Jones is saying that this drug is not good from an environmental sustainability point of view. And again, just you can look at some data about that this is not a particularly environmentally friendly crop to even grow. So some of the new narrative that you have to push back on if you want to be a prevention person and have less of this drug flowing through your community rather than more, is you have to persuade people that some revenue is not worth taking. This conversation is coming into cities and towns, and they're doing math about what 3% of sales is going to bring to their town. So first of all, you have to sell $1 million worth of pot in order to bring in what, for $30,000, and $30,000 doesn't. Well, you folks who run local programs know that $30,000 does not get you much. And we also, CVS Corporation led by example a few years ago when they decided not to sell tobacco. It was an incredibly bold move. They divested of all tobacco, and they're not going to sell it, and they're going to give up $2 billion, $2 billion with a B of revenue, because they decided as a corporation that it was not in keeping with their brand as a healthcare company, and it was simply the right thing to do. They couldn't be a health-oriented company and take a look at the death statistics around tobacco and still support and promote and make money off that drug. So you don't start with figuring out what money you're going to make selling the drug. You have to figure out what you're going to lose and what your community is going to lose by selling the drug. The new narrative is that we have to take a look at addiction for profit business models, and they really need to be curtailed. When 80% of sales come from less than the 20% of customers with problem use, that is by definition to me an addiction for profit business model. Because your profit margin exists among those users who have problem use. And alcohol is our bright and shining best example of that right now. 10% of US adults drink 75% of all of the alcohol that is sold in this country, on an average of 10 drinks a day. That's just shocking to me. So if you're someone who has a couple of glasses of wine on a Friday night, or likes to have a beer on a weekend, you don't even figure into what is driving the profit margin for the industry. Those folks who are, by definition, alcoholic, they have a substance use disorder, consume 75% of all the alcohol, and that is, anyway, you look at where the profit margin comes from for that industry. So what is happening with citizen action in Massachusetts? Basically, citizens are on their own now. Federal government used to help keep, help deal with marijuana supply. State government used to help, because you know it's always going to be in our communities, it always has been. But right now, citizens are on their own, because this market is wide open. And so how are people responding? This is a whole new kind of woke mom. When moms see billboards going up with really questionable statistics advertising to their kids where they can get more marijuana, when they understand who wrote the laws that brought this new drug to their town, when they see false advertising, when they see paid political operatives influencing local officials and state officials, you got some folks who are not very happy when they discover what happened in 2016 to this state. And, by the way, this is not new. This is a piece of our history that is as old as time. In 1961, a book came out called The Toadstool Millionaires, and it told the story of patent medicine and snake oil salesmen and quackery in the Victorian era right up through 1900. And an awareness of that is why in 1906, a Pure Food and Drug Act was passed in the United States of America that was supposed to keep quack remedies off the markets and find a way through our pharmaceutical system to put medications that had proven their safety and their efficacy into a pharmaceutical system that kept them out of general supply as much as, and protected consumers as much as we could. And then the 20th century example later was the exposés on what tobacco did to push smoking levels to epidemic levels. And we're at the beginning of what looks like another cycle now. So what happened when we had rivers burning in Cuyahoga County in Colorado, and people worked for 30 years on what to do to clean up the environment? We created a Superfund in this country, a Comprehensive Environmental Response and Compensation Liability Act that changed the way that industry did business, cleaned up the environment, and drove toxic exposures are one of those disease vectors as well. And that's gotten better since we created the CERCLA Superfund. So at one point, how bad does the epidemic have to get before we have an Addiction Prevention and Recovery Act? It's just a question I'm putting out there. Some future considerations, I guess. This was a presentation I did in February in Washington, but we've actually followed up on a few of those. I'm really interested in marijuana production site pollution. We're just starting to get calls from workers in the marijuana industry who have had exposures to mold and toxics and heavy metals. So, you know, I worked with worker health and safety, and worker harms is something I'm going to be really interested in the future. I'm really interested in seed to psychosis tracking. When we get sick kids using marijuana, I'm really, really interested in where their marijuana and THC came from. So I'd like to see seed to, not just seed to sale tracking, I'd like seed to illness and seed to psychosis tracking. And there'll be much more to come. So what is the barometer for drug policy effects? We need to look, I just feel like this policy is going to succeed or fail on use and exposure rates and related disease. If those are all going in the wrong direction, this is not the right policy, and we have to start to measure it. Our use independence going up or down? Our known harms rising or falling? Are our communities healthier and safer? And is the well-being, productivity, and life satisfaction of people better or worse? So that was, thank you. Are we done?
Where are your questions?
Okay, I've got to add a few more things though, because a lot has happened since February. So a lot of talk about marijuana, trying to market marijuana as an opioid treatment. And there's a lot of science that shows that marijuana is THC is an on-ramp drug to other addictions. And the commercialization of THC is going to bring a whole lot more people on-ramping to complicated substance use disorders. So to talk about it as panacea for it is, I guess, an interesting conversation. Anyway, we've got information that shows that marijuana is not necessarily an exit drug, because in the populations where we see more marijuana, we're still seeing opiate dependence. A lot more information on that. If you want to get these slides, I've got live links to all of these conversations. And Amy touched on them earlier. So I was invited to come and give this talk up in Binghamton, New York last week. And thank you ladies for your bravery and your courage to speak. Because when their community coalition put out into the community that I was coming to speak on cannabis commercialization, I got banned. there was a nonprofit up there that raised a big stink. And, Chief Carmichael left. I guess he takes tougher hits than I do. So anyway, that gives me a little more courage. But this is the this is the letter that was sent from something called Truth Farm, which is a little nonprofit up in upstate New York, that basically says Miss Hensley's credentials found that I have none, and that I'm financially supported by the alcohol and medical industries. And anyway, by the way, just as a disclaimer, I'm paid by no one to do my work. I never have been paid by anyone to do this work. I'm one of those coalition sector members that is a volunteer in the community. So no one's paying me for my messaging. This is my point of view based on my life experience and what I have looked at over the last 6 or 7 years. So I took a look at where this group that shut down, I call it, that shut down conversation on this up in Binghamton last week. And they're connected with something called the Drug Policy Alliance. And you can take a look at what the drug policy, they've brought most of these drug legalization and commercialization questions forward over the last 20 or 30 years. They're now publishing materials, including reports and fact sheets on drug education for teens, their parents, and their resources. And what I found on the right-hand side, easily look at Drug Policy Alliance stock images. These are all images of nice, recreational, healthy Americans using THC with their families. So it looks like marketing material to me, not drug policy material. Really important, if you want to learn more about the mechanisms of addiction in the brain, go to drruthpote.com. She is a doctor in Western Mass doing amazing work trying to educate communities around addiction. She works with kids. She is a family doc, an addiction doc, a prison doc, and she's pretty concerned about the rise of marijuana use in her patient population. And we've got folks like Mr. Boehner telling us that there's tons of incarceration around marijuana. We heard the facts on that from Chief Carmichael here. There are arrest records. Incarceration is not a factor here. If you want to learn more about upstream morbidity and mortality, take a look at work that was done called Living Downstream. I'll let you look at that. That's environmentalists will be very interested in that. And so I was accused of not having compassion and stigmatizing people with substance use disorders. And I got to tell you, that just couldn't be further from the truth. I carry in my pocket, in my iPhone, a list of the families that I know that have family members whose kids, mostly sons, and I have 2 sons, age 20 and 25 now, 25, and his brain is in good shape. You wonder if you're ever going to get there sometime. But these are families who I just personally know whose kids have had cannabis use disorders, cannabis-induced psychotic breaks, moved on to complicated addiction, had overdose. And those are 9 or 10 names within 10 to 20 miles of my home. And believe me, I'm not a super popular person right now, and I'm not all that socially connected. And I know 10 families that have been directly impacted by mental health fallout, which started with the cannabis habit. So I feel like, and I love those people, and I love those kids. So you can have compassion for the person with the disease of the disease of addiction. You can have a ton of compassion for someone with a substance use disorder. That doesn't mean you have to have compassion for the agent of addiction. And so I really want to work to disempower the agents of addiction. And we love folks who are struggling to recover, but we don't have to empower the agents of addiction. This is more on cannabis use disorders. You can look them up under DSM-5, and I think that's all I have for you. Thank you.
And organizational development. She holds a Bachelor's of Arts in Political Science from the University of Massachusetts Amherst. She served for many years in environmental protection as a liaison for the Massachusetts Department of Environmental Protection and the Strategic Partnership for the University of Massachusetts Amherst. She remains an active volunteer in civic activity and philanthropy. She is a mother, a wife, a supporter, and advisor to the Massachusetts Prevention Alliance. And please help me welcome Josephine Hensley.
Thanks very much for the opportunity to speak today. I got involved with this issue, I think in 2011 when I was elected to the school committee in Westboro and was dealing with chemical health policy. And anyway, I guess in the last 6 years I've learned more than I really ever wanted to know about drug policy. And I'm happy to share my perspective and point of view with you today. We hear a lot about public safety around cannabis policy. We hear a lot about public health. I'm going to bring a couple of other lenses to the discussion, and that is the voice of a mother and a wife. I'm a farmer's daughter. I came to Massachusetts 30 years ago for a one-year exchange at the University of Massachusetts Amherst, and my husband called that my foreign exchange. I was a fourth-generation farmer's daughter from North Dakota, grew up in the Red River Valley on a large crop production and seed farm there. I worked in environmental education, environmental policy for about 15 years. Then came back home and worked, was a school committee member for 6 years. I'm now the chair of the Advisory Finance Committee in Westboro. So on the right is some writing we've done. It's a parable of the boiled frog. Oh, we didn't flip? Thank you. Okay, the parable of the boiled frog. That goes back to Peter Sain's work in learning organizations in 1990. I was doing a lot of organization development at that time. And the parable is that if you put a frog in hot water, very hot water, it's going to sense the danger and jump right out. But if you put a frog in a pot of water and slowly raise that temperature, that frog is going to sit there until it boils to death, which is kind of grisly. But what it means is we sense really sharp, we're alert to really immediate and dramatic harms, but we're not always alert to harms that are just creeping up on us. We just sit there while the harm continues. So those of us who have this uncomfortable feeling about the way cannabis policy was moving needed to listen to what was alert within us. So did it move? All right, sorry. Coming out of the environmental movement, I kind of couldn't believe we were walking down a policy road that would put more THC in communities, more THC in every single community. As an environmentalist, I know we spent 3 decades in the pollution prevention movement trying to take lead out of our communities. And if you take a look at why we took lead out of our communities, I'm going to need a little help here. My slides are not advancing with what's up here. Okay. This scene. Sorry, everybody. That's sitting still. These are advancing. Maybe we go up and down. So I can switch. Thank you.